Hi friends, hope you are fine and safe at your home and workplace. Well, today we will discuss the NCLEX-RN test plan, which means the NCLEX-RN complete syllabus. So this syllabus is designed by NCSBN. NCSBN means the National Council of State Board of Nursing. They are the one who is designing and making the questions for test. So they have a panel which include nurses, those who are holding master's degree, PhD, and they also have experience in both clinical and educational setting. So based on their experience, they will make questions from the real scenarios, and the NCSBN, they will do a complete evaluation, and finally they will select the question for test. So this is what happening behind the test. So how long they will update these questions? That is very important. So present, the last updation was happened on 2019 April. So that one will be the same until 2022 March 1st, which means every 3 years they will update the content area of exam. So that one we have to always remember, because whenever we are preparing for examination, not only NCLEX or any of the exam, we should get the updated content, because based on the updated content they might have updated many questions in the examination pool also, and this examination question pool they are updating every 3 months. So this is so very important when we are preparing the questions and when we are studying, practicing the questions. So now we will see what is the main category and how they design these questions and what are the content areas in test plan. Here you can see the NCSBN test plan for NCLEX-RN exam. So this is updated on 2019 March to until 2022 April 1st. So almost 3 years, 3 complete years, which means 36 months. So they have divided this test plan as for based on the client needs. We should remember that based on the client needs they divided this particular sections. In that the first one is safe and effective care environment. I hope the video is clear and you can read. If you want to make your notes, you can pause in between and make your own notes. It would be very good, because before, whatever the exam you are going to write, you should have a plan. What are the things I should study and how should I study and how long I have to take for completing this much topics. So that type of timetable would definitely help in every exams. So the first one is safe and effective care environment. So that carries around 32% of questions. And the second main category is health promotion and maintenance. That carries 9% of questions. So when I am saying this percentage, we should always think in our mind that there might be a plus or minus 3%, because might be one student, she got around 29% of questions from safe and effective care environment, but other student maybe she get around 33 or 34%. So that means around plus or minus 3% variation will be in all questions. And the third category is psychosocial integrity. That also carries 9% of questions. And the last one, which carries almost 50% or the half percent of the questions are coming from physiological integrity. This is very important. So when we are thinking about physiological integrity, we know that physiological needs is the basic need for human being. So whenever we are considering a client, they also have the physiological need, and that is very important. And another very important thing you should keep in our mind, that safe and effective care. Whenever we are working as a registered nurse or as a nurse in any of the hospital, anywhere in the world, always this word we should keep in our mind, that what all the care I am delivering to my patient, it should have a safety and it should be effective in terms of prognosis, in terms of their all aspects of health. So next we will see the next subcategory of each main category. So the first one we told safe and effective care environment. Under this safe and effective care environment, we have two subcategory. So that is the first one is management of care. Here you can see the management of care, we have many topics. Actually I haven't included all the topics, but all the important topics that you have to put your concentration and make more practice, those contents I have already included in this slides. So you can see this one. So the first one is the advanced directives. And the management of care will get around 20% of questions from the management of care. We told already 32% under safe and effective care environment, and that one will be divided as two subcategory. And the first subcategory is management of care, that have around 20% of questions, and the safety and infection control, from that will get around 12% of questions. So this is the division of percentage of questions coming from each category. So the advanced directives and the advocacy, we'll just see what all the contents now, and I hope that the coming days or the coming videos will discuss some of the important topics along with some of the practice questions, so that would be very easy to understand. And I assure that if you will practice with the help of questions, that would definitely help in all of your nursing exam, not only NCLEX-RN exam. And the fourth one is case management, client rights, then confidentiality and privacy, then informed consent. Informed consent is the one of the important topic. You should put double star for that topic, because whenever we are going for exam, not only NCLEX-RN, even for CBT or HAT or Saudi Promoting, whatever it is, we will get at least one question which have a connection with the informed consent. So that is very important, keep it in our mind. Then the next one is information technology, then legal rights and responsibilities, then quality improvement. See, these are some of the important topics under management of care. Then the next one is safety and infection control. As you all know that now we are going through a very crisis situation, and we have corona problems, and some of the countries, I think most of the international centers are not open for writing these kind of nursing comprehensive exams. So why I mention here all these things means, nowadays the students are getting, especially the NCLEX-RN students, they are getting more questions from the infection control aspect, which doesn't mean that we'll get questions from the corona, because the corona is not will get a complete picture in theoretical way, because it's still in front of the table of researchers. So we may have to wait minimum months, because we have to get a thorough picture, and how the transmission, and how much or what are the precautions we can take. Those things we have to study and make the final final theoretical part. So even though we'll get more questions from the other infectious diseases like tuberculosis, measles, MRSA, so these are some of the main things we have to keep in mind when we are preparing the questions. I will give an example right now, because I hope most of you know that this tuberculosis and measles will provide airborne precautions, negative isolation. But in MRSA, it's contact isolation. The contact isolation, usually there are some questions will come like, which patient can be a co-patient for an MRSA patient in case inavailability of a single room. Which means in the hospital, they don't have a single room for this MRSA patient. And along with which patient, this MRSA patient can be a co-patient, or along with which other contact isolation patient she can be with. So in that case, we should always remember in mind that same organism patients can only be a co-patient even though it is contact isolation, which means the patient who can share a room with the same organism of MRSA, or the other patient also have the same MRSA contact isolation. She cannot share the room with the other contact isolation patient who's have another organism. So that is always keep in our mind. So we'll see what are the topics comes under safety and infection control. Hope what I am discussing you are getting. If you feel much difficulty, you can mention as comments. So I will try to make it slow, or I will improve myself. The first one is accident, error or injury prevention. Then the second one is emergency response plan. Then ergonomic principles. Everybody know, I think, ergonomic principles while we are transferring the patients, when we are bending to take some things. So what are the principles we have to follow to protect ourselves as well as the clients. Then the handling of hazardous and infectious materials. That is very important. That is also we can expect many questions from this part also. then safe use of equipment, then security plan, standard precautions, transmission-based precautions, surgical asepsis, then use of restraints or safety devices, and what is the policy. I think some of the other hospital, they have their own protocol, but when we are preparing for the NCLEX-RN exam, there are certain protocols which is following in all over the United States of America. So those protocols and the principles of restraints, everything we have to study well. Then only we can answer when we'll get some options which might be confusing. I hope you clear with the main contents which will come under this safe and effective care environment. So shall we move to next slide? Well, the next main category is health promotion and maintenance. So health promotion and maintenance, the main contents are aging process, then all antepartum, interpartum, postpartum, newborn care, developmental stages and transitions, then health promotion and disease prevention, the primary disease prevention, primary prevention, secondary prevention, tertiary prevention. These all things we should keep in mind. Always, I will give you a clue, always the tertiary prevention, it might be something related to rehabilitative activities. So these things we should keep in our mind. Then the health screening, then high risk behaviors, lifestyle choices, self-care, techniques of physical assessment. See, here we said technique of physical assessment. I think most of you know that when we are doing a physical assessment, the normal steps we are following, or the normal method we are following, like first we'll start with inspection, then palpation, percussion and auscultation. But when we are doing our assessment for abdomen, the method it's or the rotation is a little bit different. First we will do the inspection, second one is auscultation, then third palpation, and fourth one is the percussion. So the first one is inspection, second one auscultation, third one palpation, fourth one percussion. This is only for doing the assessment of abdomen. So now you got, so this one also will get around 9% of questions from these aspects. So this one we have to keep in our mind. So next we will move to the third main category, which is psychosocial integrity. See, when we will listen this word itself, we will understand the psychosocial, which means the things that will affect the social life of a person, or the psychological mental health of a person, or some things will happen in our life that will totally alter our mental status. So those things are some of the main contents comes under the psychosocial integrity. This one, from this we'll get around 9% of questions. Even though we'll think only 9%, but the topics are a little bit, we will see it's more topics, so we have to study everything. So the first one is cultural awareness or cultural influence on health, like our spiritual beliefs and our religious and spiritual influence on health. Some maybe you know that some of the Jehovah's Witness, they will not receive the blood transfusion. They will not give the consent for blood transfusion because as per their spiritual beliefs, they consider it is not a practice that can they will do in their spiritual life. So those are some of the different things that we have to study before we are going for the exam, and also before we are going to work in the clinical area. We should know, because if we don't know, maybe when we will listen that one, we may feel why it's a patient condition is very critical and she doesn't have her hemoglobin is very low, then why she is. So for that also we should study the ethics. There are a lot of principles that we have to follow. We should respect the patient rights, patient spiritual beliefs and their influence. Everything we have to respect. Then the sensory or perceptual alterations. Then the next one is stress management, how we are coping with the stressful situations. Then substance or other substance abuse or other disorders, dependencies. Then therapeutic communication, that is very important. Then support systems, then therapeutic environment, abuse or neglect. When I see this word abuse or neglect, this is also one of the important things. Especially the questions might be related to one of a geriatric patient or a child who is living in a situation where he's getting some kind of abuse or such kind of behavior from the family members or the environment. So those things we have to do the assessment. And whenever we are reporting an abuse or neglect, before we should make a thorough assessment. That is very important. Then the next part is behavioral interventions, then coping mechanism, then grief and loss, the family dynamics, end of life care. So these all topics are connected with the psychosocial integrity. So we'll move to the main and important part, that is physiological integrity. How many percentage questions we can expect from this one? Around 50% of questions are coming from this main category. So in this one again they divide as a 4 subcategory. That the first one is basic care and comfort. Then the second one is pharmacological and parental therapies. I know when you listen this pharmacological word, maybe many of our friends and many of them get frustrated or disturbed, because we are not that much thorough with the pharmacological aspects. But I assure that when you are studying the pharmacological, especially the medications, everything, try to make group like beta blockers, like this will make group and we will study. That would be easy to remember. Especially the medicine that will end with the lol. So these are some of the clues. So if we'll look at that one and we will classify or will group, we can study very easily. Then the next subcategory is physiological adaptation. How a client is adapting to the physiological situations in terms of their illness and their medical problem. Then reduction of risk potential. So the physiological integrity, we can expect around 50% of questions, and that one again divided as 4 subcategories. So the first one is basic care and comfort, the second one is pharmacological and parental therapies, and the third one is physiological adaptation, and the fourth one is reduction of risk potential. Hope you understand. So we'll see to the next slides, and we will see how they are dividing or what all the contents will comes under each subcategory. So here on the left hand side we can see the first one is basic care and comfort. So what all the measures we have to take to ensure the comfort of our client, and what all the basic care we have to maintain, like elimination, then some of the assistive supportive devices, mobility or immobility, and the non-pharmacological comfort interventions, like we can provide some relaxation therapies, then nutrition and oral hydration, then personal hygiene, rest and sleep. So these are some of the basic need or the comfort measures that we should ensure whenever a client is admitted in the hospital. Then the right hand side we can see the pharmacological and parental therapies. So what are the main parental therapies, like peg tube feedings and all those things. Then the pharmacology, blood and blood products. See here I will see blood and blood products. So when we are studying blood and blood products, we should study all the aspects. Who all are the patient have some of the religious influence on that. Maybe they will not receive based on their spiritual aspects. And what all are the conditions or what all are the side effects, or when, how to start, what are the things we should check for the safety of the patient. These all things we should keep in our mind when we see a question based on blood and blood products. Then the next one is central venous access devices. Then dosage calculations, medication calculations, that's easy. Then expected actions of outcomes, then medication administration, parenteral or intravenous therapies, pharmacological management, pain management, then total parenteral nutrition. So these are some of the main topics which is related to pharmacological and parenteral therapies. So here we see basic care and comfort, then pharmacological and parenteral therapies. Next we will move to reduction of risk potential. So what are the measures we should take to reduce the some of the problems that will happen in the hospital or client health settings, that is changes or abnormalities in vitals. See, when we are taking a vital signs, we know that, see, for example, some patient suddenly they develop tachycardia or bradycardia. So we should take a precautionary, or we should immediately take measures to prevent further problem for the patient. Then the another one is diagnostic test, then laboratory values, potential for alterations in body systems, then potential for complications of diagnostic test, treatments, procedures, then potential for complications from some of the surgical procedures and health alterations, then system specific assessments, therapeutic procedures. So these are some of the main things which is related to the reduction of risk potential. Then we will move to physiological adaptation. So how the client is adapting to the physiological situations, alterations in body system. Then fluid and electrolyte imbalance. The fluid and electrolyte imbalance also is one of the important topic. We can expect some questions from this one. Definitely there are some questions, and in sometimes the questions might be related to the normal values. So we should study at least some of the common normal values, some of the like for example potassium, creatinine, burn. So at least we should study some of the normal values of this blood test and all. Then hemodynamics, illness management, medical emergencies, pathophysiology, unexpected response to some of the therapies. So these are the things related to the physiological adaptation. So we have completed all the content area of NCSBN design of NCLEX-RN test plan. Hope you understand, and if you have any doubt based on this one, you can go to the NCSBN website. I already add in the description, you can see that one. So just go to that website, you will get more information. So why they are updating and how the updated contents are, what is the reason behind of updating, and based on what factors they are updating questions. For example, on the previous years, they are giving some of the research item questions for the students, those who are appearing for the exam, and they will see how the students are answering those questions. So those questions, after that particular updation, when the next updation will come, these questions they will take it for granted, and they will update with the more contents from those particular research question cited contents. And also they will see on the previous update, based on the previous updates or based on the last 3 years, how the students percentage, like maybe out of 100 students, around 70 or 75% students are not giving answer to certain particular areas, which means that we are not getting a proper information based on that aspect, or something, there is some problem. So they will do a proper evaluation for those things, and they will, when we are updating the next test plan, they will add questions from that one also in a various different manner. So these are some of the common aspects related to the NCLEX-RN exam, and the category, content area, and the updation, everything. Hope you understand with the content. So if you are clear with this topic, please share with your friends who is looking to study for their NCLEX-RN, or who is waiting to prepare for their NCLEX-RN exam. And also like and subscribe our channel to get more videos related to some of the other important content areas. Thank you. Take care.